So here, you're left with the brain here. You're not looking at the vertex. How will you find out where the central sulcus is? No, because there are several of those lines there that appear to be originating from the vertex here. You see one here, and you see one go down here, and then there's another one here in between those two, and you have another one here. So where is the central sulcus Rolando? So the hint is it's difficult to see it from here. So ideally, you would have to follow those grooves from the vertex and see where they lead. Okay, so the central sulcus must lead down to this deeper fissure I was talking about earlier. So this deep fissure here, you follow it with your eyes or your fingers. So you keep your fingers here and you trace. This one, does this go straight to the vertex? If you follow it, it seems to end here. It ends here, then goes up again here. So not very constant. What about this one? You follow this sulcus here, you follow it here, it ends up here, and that's your end stops there. So that is a clue that this is not a central sulcus of Rolando. But if you follow this one, it seems to go uninterrupted all the way to the vertex. What about this one? This one is not connected to this fissure here, so we don't count that. But it seems to go to the vertex as well. So which one is it? Okay, I'm not quite sure if I'm correct in highlighting that part. But it seems to be the one I pointed out earlier that seems to reach the vertex. How about on this side? So using this fissure as your guide, you look for the lines that go up from here. This one looks deep, but it ends here. So maybe it's not that one. This one never touched this fissure here, so we'll disregard that. This one seems to originate from that fissure down here, and if you follow it, goes straight to the vertex there. So that's a very suspicious looking groove that goes all the way up to the vertex. Other ones will be interrupted here. It stops here, so we can't count that. So am I wrong? I probably put it in the wrong place. So the concept is it has to start from the vertex and has to be uninterrupted. So this one is another consideration. But the only way to be sure is to look at it from the top looking down. So that's the central sulcus, and as I mentioned, in front of it is the frontal lobe, and behind it is the parietal over here. So these drawings are always constant. So medyo madaya kasi they already highlighted and they already have numbers on them. So this gyrus, which originates from the vertex and goes downwards towards this fissure here, and then it resides in front of that central sulcus, is what we call the precentral gyrus. So here is where all those motor neurons are, all the motor neurons that control your muscles, residing in this so-called motor strip, or the precentral gyrus, or the motor cortex. So there's a inconsistent sulcus in front of it, the precentral sulcus. So as I mentioned, the only way that you can be sure that you're looking at the precentral gyrus or the central sulcus is you need to see a sulcus originating from the interhemispheric fissure that goes down towards that fissure down there, that forms a bend like this, which forms an inverted omega, or omega if you're looking at it from the front. So it is this sulcus, and it seems to be mirrored here on the other side. So this is the central sulcus. Therefore, the gyrus in front of it is the precentral gyrus. How can you be sure that's the one? Because there is nothing else in front of it. All the other gyri that you see here appear to travel from front to back, no, from anterior to posterior. So that's the difference of this precentral gyrus here. It is the only one located here that travels from vertex to ear, whereas everything else in front of it is frontal to occipital, or anterior to posterior. So the same with this one, the same with this one. So these are the frontal gyri, but this is the prefrontal gyrus here. So that's the difference. The orientation is transverse. And that's the central sulcus of Rolando with that omega over there. Okay, so precentral gyrus in front. Same figure. And then the inconsistent precentral sulcus in front, which now defines your precentral sulcus. I mean, precentral gyrus. Now, all about that very deep fissure here. So since it's the most prominent fissure that you will see, this is actually the easiest to find, especially if you have to make a small hole only for surgery in this area. So to orient yourself, you need to find this fissure. That's called the fissure, the Sylvian fissure. Okay. So the Sylvian fissure is what demarcates your temporal lobe down here from the frontal lobe superior to it. And the gyrus that travels down from the apex or the vertex to the Sylvian fissure is your precentral gyrus. Okay, so it cuts all the way here to separate the temporal lobe from the parietal up here. So that's parietal and that's temporal. And the sharp end here is your occipital lobe. So now here you have a brain, unlabeled, no lines, no numbers. So how do you find the Sylvian fissure? Is the easiest one. So you look for the temporal lobe, and this is your Sylvian fissure, which is quite deep. And as you follow it, it ends into some gyri here in the parietal lobe. And you see this sulcus here that travels the way down to connect with that Sylvian fissure and seems to go all the way up here. And it forms an omega. So that is your central sulcus. And also the same brain I showed you earlier. Another brain seen from the right side. So Sylvian fissure. So this point, which is quite prominent, no, and consistent across all brains. So for the neurosurgeon, they use this as a marker, so they don't get lost. That's the anterior Sylvian point near a triangular looking gyrus here in the frontal lobe. So looking at it from the front, yeah, the Sylvian fissure forms a smile over here. So those are the Sylvian fissures on the right and on the left. From the bottom, the Sylvian fissure is where you can insert your finger to separate the temporal lobe from the frontal lobe up here. Okay, so about those gyri in front, since the prefrontal gyrus is transverse, all the rest are longitudinal. So from front to occipital. This is the superior frontal. So the one closest to the midline, so fairly easy to find. So you find this number 7 or letter L, depending on how you're looking at the brain. So a transverse going gyrus versus a longitudinal gyrus here. So there are 3 longitudinal gyri here, the superior one, the one in the middle, and the one at the bottom. So these sulci are inconsistent, so we're just showing it here for reference. So they're not complete as this central sulcus. It's just meant to tell you that you're already near the middle frontal gyrus down here. And the remainder, since there will be a sulcus again, imaginary one, if you want to make it, which separates the middle frontal gyrus from the inferior frontal gyrus. So among the three, all of them are longitudinal, but one is bigger than the remainder because, well, on the dominant side of your brains, this is where most of your speech areas reside. So schematic, a transverse precentral gyrus and three longitudinal gyri which travel from frontal to occipital, the superior, the middle, and the inferior frontal gyrus. That completes your frontal lobe here in front. So just emphasizing that inferior frontal gyrus can be further. Some will have a constant feature. So there'll always be a apex here of a triangle. So that's the anterior sylvian point. So demarcating a part of this inferior frontal gyrus that is right next to the precentral gyrus, which will form a flap of brain covering the sylvian fissure, the so-called operculum. Hence, this part is called the opercular part, or the pars opercularis of the inferior frontal gyrus. And this triangular shape one, although you really have to stretch your imagination. So the only thing that makes it triangular is that apex formed here. So that is the triangular part, or the pars triangularis of the inferior frontal gyrus. And the remainder, which are above your orbits or part of the orbital part of your frontal lobe, is the pars orbitalis. So all these three comprising your inferior frontal gyrus. More important on your dominant side, because these are actually the parts of your brain that move your mouth and your tongue to create words. Okay, so that's the precentral sulcus with the superior, middle, and inferior gyri in front. Never mind the sulci, just helping us demarcate the superior, middle, and inferior frontal gyrus. In this particular brain, the apex is more prominent, although it is always prominent among all brains as a guide for neurosurgeons. So this is your pars triangularis. So using that as your marker, if this is pars triangularis, then behind it would be your pars opercularis, and the remainder in front of the triangular part is the pars orbitalis. So I have to correct this, orbitalis. So this picture just shows the variations in terms of how it looks like. So it's not always picture perfect when you see it in an actual brain. The only thing constant is this triangle here. So that's the precentral gyrus from the top. So this is a view from the top of the brain, from the apex, the vertex of the brain. Just completing the pictures, emphasizing that all other sulci are broken. They're never really complete. More or less, there will be a gyrus here, which is closest to the midline. And that's the superior most one in the middle, and one beneath your inferior one. Now, if you look at the brains from below and you took away that olfactory nerve there, so you're left with this very straight looking gyrus here. So because it's so straight, it's called the gyrus rectus. So this is the most medial gyrus when you're looking at it from the bottom. So from looking at the ventral surface. So that groove there, which contains or used to contain the olfactory nerve, is what we call the olfactory sulcus or olfactory groove. The remainder, just like the orbitalis part of the inferior frontal lobe here, comprise your orbital gyri. So we'll not get into the nitty-gritty of this, whether it's medial or lateral. Just know that these are the orbital gyri. So on this brain, highlighting for you the straight gyrus here and the orbital gyri lateral to it, and that's the olfactory nerve sitting on top of it.